Thank you all and welcome. I'm Gary Null. The program deals with health and nutrition. It's estimated that nearly half of the hospital beds in the United States are taken with people who have emotional problems. Unfortunately, the traditional approach, either electroconvulsive therapy or some form of medication, does not resolve the underlying cause. We believe, however, and we're going to try to demonstrate that on today's program, that there are non-invasive, non-toxic methods of trying to deal with serious conditions such as depression, using substances as simple and easily available as amino acids, the building blocks of protein. Stay with us. We'll be right back. Thank you. There's a new breed of doctor in the United States. This new breed of doctor believes that you don't have to be limited in how you both treat disease and how you try to classify disease. Dr. Eric Braverman, who works with Dr. Carl Pfeiffer and is the co-author of this very important book called The Healing Nutrients Within, believes that there are many nutrients, substances around us that once we understand how they work and in what combination they work, can help alleviate and prevent many conditions. Welcome to our program, Dr. Braverman.
Thank you, Gary.
One of the most serious conditions that we have in the United States, or a group of conditions, they're actually a group of symptoms, are emotional problems, mental imbalances. From your experience, could you share with us which of those conditions you've been able to help and by what method, giving us some of the specifics, maybe even a case history?
Well, depression is certainly one of the diseases, you might say, that's treatable with nutrients, particularly the nutrient tryptophan, which is one of the most commonly deficient nutrients in depressed patients. I can remember in particular a young woman who was 24 years old came into my office and said, "Doctor, I'm going to kill myself and kill my baby." And after testing her blood, we found that she had no detectable tryptophan in her blood. And we went ahead and gave her tryptophan, not even with an antidepressant, though sometimes I use an antidepressant with amino acids, and within a very short time she was sleeping normally and much in terms of her aggressiveness ameliorated.
That's remarkable. What other types of conditions beyond depression and what other amino acids might work other than tryptophan?
Well, there's been studies in terms of depression, studies at Harvard Medical School by Dr. Gellenberg using tyrosine. Tyrosine is another amino acid. Amino acids are the building blocks of protein. And this amino acid was found to be very helpful in antidepressant-resistant depression, individuals who didn't get better with antidepressants in very large dosages. And so the amino acid tyrosine is one that's used more for monopolar depression or a flat depression where a person is just sad, they have no emotion, and they seem flat. And generally, we look at depression in that terms, either a flat depression or an aggressive depression, like I mentioned in the first individual, who generally respond better to tryptophan.
Has it been your experience when analyzing their diet and the history of their biochemistry that these people had a lifestyle that was conducive to lowering these chemicals in the body and therefore making them more susceptible to their depression or anxiety or some other condition?
I think definitely. I think that we find that individuals who tend to depression will be tending toward lower protein foods as they get more depressed. It's hard to say what, of course, comes first, depression and then the poor selection of foods, or the poor selection of foods and then the depression. I'm sure they're, in most individuals, dynamically related. But it's very unusual to find a person that's eating extremely well to suffer a major depression like the one I first mentioned.
When you look at the political leaders of the world today, their diets are an abomination. Have you ever examined, just out of curiosity, what people are eating and how that might be affecting their interpretation, their impressions, their perceptions? And could it indeed cause perceptual disorders which then lead to policies being offered that themselves are very imbalanced?
Well, it's certainly, food can lead to a lot of disperceptions if you eat poorly for a long time, and this is fortunately no longer an unusual idea in terms of just holistically oriented doctors or alternative doctors. Dr. Wertman at MIT has done a number of studies showing that behavior is linked to what we eat. Empty carbohydrates can lead to depression. They can lead to overeating habits. How far it goes in terms of the world environment, sometimes I think that a Cold War maneuver is to export Pepsi-Cola and all our other, and McDonald's. There's no more dangerous or more aggressive thing than to export those type of foods to other countries. How much it affects the minds of those individuals, hard to say.
What do you say to a doctor who may be properly credentialed, even board certified, who's a power broker? In other words, they represent the opinions of thousands, hundreds of thousands of doctors, and they'll say there's no value to vitamins. Amino acids are nonsense. Enzymes your body produces so you don't have to worry about them from food. And the average American diet is excellent. Anyone who says to the contrary is merely trying to mislead you. How do you respond to that?
Well, there's two levels of response. One is, in terms of the book, my book, Healing Nutrients Within, we have over 1,300 references. In other words, when we're talking about tryptophan and tyrosine for depression, we're dealing with some of the best medical researchers in the United States that are well respected among academic psychiatrists. So to me, already they wouldn't know the medical literature if they were saying that there's no role for amino acids. After all, it was Boston Sleep Laboratory, Dr. Hartman, who was on the staff, I believe, at Harvard Medical School, that did the first research with tryptophan as a sleep-inducing amino acid. And we know so many Americans, somewhere about 11 million Americans, are addicted to drugs like Valium and similar drugs. There's so much literature saying that tryptophan is a superior alternative that I think that they would be incumbent to come up with information showing me contrary. On the other hand, sometimes that type of logic doesn't work. Even if I bring a stack of papers and say, well, here's all the literature on tryptophan, compare it. The other aspect is a doctor is just not the best individual to discuss lifestyle. There was an article in Lancet, a British medical journal, which says the following conclusion, that doctors either don't benefit from what they know how to live, or they don't know how to live because they turn out to have worse mortality statistics and worse health statistics than the average professional did in that study. So there's two lines of approach. One is the intellectual. Here is all the papers that show that this nutrient has some efficacy and value in psychiatry. And the other is, remember that you as a doctor shouldn't be that prideful, because the physician has not necessarily been proven as the most expert in lifestyle and health matters.
We've been talking about depression, but there are other areas of the body that can benefit as well from good nutrition. I believe one that is opening up more so than others is the area of heart research, vascular research, and that includes high blood pressure. A simple herb, in fact, the most important healing herb, garlic, was shown in a recent experiment to lower blood pressure, cholesterol, and triglyceride levels substantially, equal or surpassing that of the common medicine that would lower blood pressure with none of the harmful side effects. What have you found has benefited high blood pressure in having it lowered from a natural perspective?
Well, that's another field where, again, the medical literature is just saying outstanding things for nutritional approach. Besides the fact that if you look at medical science papers, they talk about a diuretic or water pill as a very dangerous entity, which raises triglycerides, raises cholesterol, and increases heart attacks over time. The same is being said now for the common beta blocker used for high blood pressure, so much so that even the prestigious AMA medical journal said the first approach to mild hypertension is dietary therapy in the March issue. In the book, Healing Nutrients Within, we talk about taurine, an amino acid mainly studied in Japan as a blood pressure lowering amino acid. But what I have been able to put together is really a protocol for high blood pressure.
Hold your protocol. We'll come back and take it on in a moment. We'll be right back. Welcome back. I'm Gary Knoll. Dr. Eric Braverman is my guest. He is the author of The Healing Nutrients Within, a major new book on the subject of health and nutrition and prevention. Dr. Braverman, please continue. You're about to give us your protocol for lowering blood pressure and keeping it lowered naturally.
Well, you were talking about garlic, and so I wanted to mention the amino acid taurine. But for complete lowering of blood pressure, you really need to also use the fish oils, which have been talked about so much. They're usually called EPA or Mega EPA. Max EPA is not the best of the brands, but the fish oil is probably the most potent form of blood pressure lowering and triglyceride lowering pill there is. Just to give you an example, I had an individual with 1,800 triglycerides, which is 18 times normal, and his blood was, when you pulled the blood out, it looked like about half fat. You could see the white. It's called lipemic blood. And with fish oil capsules, 15 a day, which is a very high dose, and no one should do that on their own, it became completely normal. In addition, his blood pressure dropped many, many points, and he worked his way off of a water pill, a beta blocker. In addition, there's primrose oil, which can lower blood pressure. Vitamin B6 can lower blood pressure. Magnesium is the only nutrient used in pregnant women to lower blood pressure. If a pregnant woman has high blood pressure, she will get magnesium, not a beta blocker, not a diuretic, but she'll get magnesium to lower pressure.
That's terrific. We're going to go to our audience now and see what questions you might have. Yes, please.
So I'd like to make a statement about tryptophan. I've had erratic sleep patterns, and since I started using it 3 months ago, it's stabilized and it's uniform every night. I'm very happy with it.
Oh, that's fantastic. What dose did you use for?
I'm taking 400 or 500 units a night.
And that's not high. That's not bad. Good, thank you. Another question, please.
Yeah, I like to know how much of from the food that we eat, the vitamins and nutrients, get actually absorbed into the bloodstream.
Well, that's very dependent on a lot of different factors. But to give you some idea, when a person takes 500 milligrams of tryptophan, they might be taking about twice or once to twice the dose that they might normally get from the diet. So that's not a very significant supplement. But there are individuals who might supplement tryptophan at 3 grams, and so they'll be absorbing six times or 5 times what they might be taking in by the diet. So
Okay.
absorption it's very variable.
Are there other questions?
Doctor, I'd like to know if you've treated alcoholism through nutrition, had any luck with it?
Yes, I have. The thing with alcoholics, one can say the following, that almost every single nutrient is deficient and important. So much so in the 1930s they took the vitamin thiamine, vitamin B1, and put it in alcohol and hoping that this would prevent the Korsakoff syndrome, the alcoholic dementia. That's obviously not the best approach to alcoholism. Others have argued that niacin and niacinamide are the best approach to alcoholism. There's a new approach using lithium in low dosages, which is kind of a mineral and also a type of a drug that's used in alcoholism. But there are many good approaches to alcoholism besides using Valium-type drugs, which is usually the mainstay in most AA alcoholic clinics.
I might add to that a Dr. Alfred Libby in California has done probably more work with alcoholics and drug addicts than any other physician in the United States using natural techniques. Now, one of the more common elements of the Libby formula is to give intravenous vitamin C drip solutions daily, and usually he starts off at around 100,000 milligrams because he finds that the blood and the cells of the alcoholic and the drug user are so deficient, so depressed in vitamin C, that it takes that amount to get them back up to a normal position. He also finds that millions of Americans are in what Irwin Stone called a scorbutic state, meaning they don't have classical scurvy, which is what the British sailors died from in the thousands because they didn't have vitamin C when they were at sea. But all of us are walking around, not all of us, but many people with low doses, not enough to cause a classical deficiency, but causing subclinical deficiency. And medicine today does not recognize these subclinical deficiencies. And alcoholics are virtually across the board suffering from vitamin C deficiency. And he has helped them. He's gotten them off their drugs and off their alcohol without the serious side effects. So that was just some. Did we have any other questions? Okay. Dr. Braverman, when you're working, and you're working, of course, with Dr. Pfeiffer, How do you do a workup on someone to determine what is and is not imbalanced in their body?
Well, it's not so easy to test nutrients, if that's what you're asking me, in terms of finding the deficiency. We do amino acid blood tests in certain individuals, particularly individuals with depression. Individuals with allergy will get immune globulin E tests and immune studies. We now have a test of T helper cells and T suppressor cells that we do in individuals with immune diseases and allergy diseases. But what I've come to the conclusion is that the approach towards nutrition is very much more of a clinical approach, meaning it depends on history taking. When you study an individual's history and symptoms, you have the real keys to treating them nutritionally, more so than blood tests. And I have not been very impressed by the results of glucose tolerance tests as a routine procedure, the use of other nutrient studies as the key approach.
How about the cytotoxic test for determining food allergies?
Well, it's not my favorite test. I've come to the conclusion that it was not consistently accurate. I saw many cases of individuals taking the cytotoxic. Follow-up after they felt they weren't allergic to the food did not show that they were not allergic to the food. In other words, I get mixed results. The patient says they're better, and the cytotoxic test doesn't show they're better. So it's not my favorite test. I've been a little disillusioned by it as a useful study.
What's the best test for determining heavy metal toxicity from lead, cadmium, mercury, including mercury in the dental fillings?
Well, there we do have good tests for heavy metals. And heavy metal tests, hair is extremely accurate for heavy metals. It is not accurate at all for nutrients, just about, other than the heavy metals. Certainly you can measure heavy metals very accurately in plasma and red blood cell and other parts of the blood. So there's really no doubt in my mind that we can establish individuals that are toxic from lead, aluminum, and there are great antidotes. Interestingly enough, zinc is almost the universal heavy metal antidote. It's the antidote for aluminum, it's the antidote for lead, it's the antidote for cadmium, while selenium is the antidote for mercury. So there are a lot of good nutrients that antidote.
Good. We'll be back with Dr. Eric Braverman closing up in just a moment. We're talking with Dr. Eric Braverman about the role of nutrients in health. Dr. Braverman, many letters I receive each week talk about complaints of working in major industries where the manufacturer's not acknowledging the exposure to a toxin, but they feel it. They're coming down with more diseases, and one of the more common problems is aluminum. What would you suggest for those millions of Americans working in heavy industry that are exposed to aluminum?
Well, it depends on how they're exposed. If they're exposed by inhalation, that's very difficult to treat. But if they're getting it through somehow dietary way, inhalation, well, then really you have to approach it through all the antioxidants. We know that zinc is an antidote to aluminum in the blood. I'm not sure if it's an antidote for aluminum in the lungs. In the lungs, what happens with aluminum is it forms immune reactions. And to stop those immune reactions, if there is an approach nutritionally, it would be the antioxidants such as cysteine, vitamin E, vitamin C, selenium, and those type of nutrients. In the blood, we have some very good antidote for aluminum. In fact, we know aluminum can cause senile dementia because it caused dialysis dementia. Individuals who lost their memory because they were dialyzed for kidney failure with water that had been softened with aluminum, that has been treated with aluminum. They stored the aluminum, went into their brains, and they formed dementia. Ever since then, we've been looking at the aluminum-dementia link-up. It is not as clear-cut link as we hoped it would be, but certainly we'll find that the Mylanta and other antacids that have aluminum are not the best forms of treatment. Other sources of aluminum are not healthy either.
Okay, thank you very much. Let me just mention that Dr. Eric Braverman's book, along with Dr. Carl Pfeiffer, is called The Healing Nutrients Within, a Keats publication book. I certainly recommend it. I had a chance to read it some time ago. Well, as we do on each of our shows, we try to share information on how to improve the quality of your life, whether it's looking at the environment, looking at the politics of medicine, or looking at the quality of our diet. When we start to take responsibility for our own health, then we become that much closer to connecting to the link that we're responsible for the world that we live in. I hope that you join us on our next program. I'm Gary Knoll. Thank you all for watching.